we talk about central pedicle breast reductions and reduction mastopexy. It's important to know the blood supply of the central pedicle, and I want to remind you to go back to the videos we had described the relevant blood supply of breast, as well the ligamentous and fascial anatomy. You can find the links for these videos here under the title. Again, I remind you by the ligamentous anatomy of the breast. In previous videos, we said that fibrous condensations arise from medial and lateral borders of the breast, as shown in the pictures here in the slides in the pink color. And these fibrous condensations from the medial border and lateral border of the breast forms the horizontal septum at the level of the nipple areola and opposite the level of the fifth intercostal space, and actually dividing the breast into cranial and caudal parts. So the importance of this septum is that blood supply from the medial aspect of the breast, namely the intercostal perforators of internal mammary artery, as well as the blood supply from the lateral aspect of the breast. The perforator arises from the lateral thoracic artery, run in relation to this horizontal ligament, or the so-called central septum. So the central pedicle of the breast is supplied through vessels run through the central septum of the breast. The central pedicle, or the central pillar, or central septum, is mainly supplied by the intercostal perforators of the internal thoracic artery, branches of the lateral thoracic artery, and an important perforator branch from the thoracoacromial artery. Finally, the pattern of blood supply of the central pedicle is almost perforators comes from posterior chest walls, so sometimes it is even called posterior pedicle. To understand well the central pedicle, we start with drawing. We draw the wise pattern markings for breast reduction. In the picture shown here in the slides, there are three areas of concern. The area marked in pink color is the area of the central pedicles, where circumareolar deepithelialization is performed. Here we do deepithelialization circumareolar around the areola. Okay, and the area marked in yellow color is the area up of the new nipple areola. This is for the new nipple areola complex, and blue for glandular resections. And the third area marked in gray color, which is the area lies actually between the pedicle and the both medial and lateral pillars. Usually the diameter of the pedicle ranges from 10 to 12 centimeters, and the length of the both medial and lateral flaps, or lateral, medial and lateral pillars, ranges from 6 to 8 centimeters. The glandular resections for the superior and inferior pools are made in full thickness fashions over the pectoralis fascia, as we said, in the area marked in the yellow color. The wedge resections on both sides of the pedicle tissue should be in a partial thickness, so that you leave sufficient tissue at the base, thus protecting the central pedicle's vascular continuity with the breast septum. Very important when you make a tangential resections for the both medial and lateral pillars, to leave a thickness for the flap on the medial and lateral pillars about 1.5 centimeters. And as well, the tissue you leave on the pectoralis muscle fascia it is of a thickness of 1.5 centimeter. So 1.5 centimeter for the medial and lateral pillars is sufficient to protect the vascularity of the medial and lateral flaps. And 1.5 centimeters for the tissues, you leave it on the pectoralis major or pectoral fascia. It's sufficient to save and protect the vascular supply comes through the septum, and vascular supply comes from the posterior to supply the central pedicles, and as well to protect the nerve supply comes through the fourth intercostal nerves runs within the pectoral fascia and come and to supply the nipple areola complex. So again, the tissue at the base of the wedge sections on both sides of the pedicle maintains the central pedicle vascular continuity with the breast septum. The very mobile central pillar advances directly and easily to the new nipple areola without any risk of torsion. And the medial pillar, the medial pillar and lateral pillar join each other at the midlines and to support the central pedicles and avoiding future bottoming out. Finally, the inframammary fold is advanced superiorly and it's fixed to the pectoralis fascia and to the inferior border of the pillars with a heavy absorbable suture. This is a very fast or quick idea about the central pillar or a central pedicle for a breast reduction or a breast reduction mastopexy. Thank you.